News.
Thanks so much for joining us. I'm Jackie DeTore. Fox 43 is getting some answers to your questions surrounding the COVID-19 coronavirus outbreak. Joining us now via Skype is Krista Fletch, the Vice President and Chief Medical Information Officer from Penn State Health. Chris, thank you so much for joining us. We know people have a lot of questions about what's going on right now.
Yeah, thanks for having me. It's always strange doing this remotely, but like everybody else, we're practicing our social distancing.
Absolutely. And Chris, you'll be with us for the next half hour or so. We have a lot of questions to get to, so let's get right into it. First of all, this is the biggest question we're getting because it seems to be changing a little bit. So what are the signs and symptoms of COVID-19?
Yeah, so just in general, COVID-19 is a very specific coronavirus. You see the word coronavirus floating around. Coronavirus is a family of viruses. There actually is about 7 that have been known to infect people over the years. This is a new one. And so coronavirus seems to be acting a lot like many respiratory viruses, where sometimes you won't see any symptoms. Sometimes you'll start seeing some cough or low-grade fevers. There's a little hint that maybe there's a little bit of gastrointestinal upset, but for the most part, it seems to be a respiratory type virus. You know, upper respiratory symptoms, sore throat, nasal drainage, and, as it progresses, shortness of breath.
And what's happening in Pennsylvania right now? We see the numbers continuing to go up each day for the confirmed cases. So do you believe COVID-19 is now being spread by what's being called community spread?
Yeah, I think the answer is yes. CDC agrees. And so, there's a lot of catchphrases and words that get floating around here. So, community spread really just means that there's person-to-person contact or surface contact transmission. And it does seem that both surface and respiratory or droplet contact spread seems to be prevalent with this virus. And yes, we are seeing community spread.
And we also know a lot of people are asking about testing and availability of testing right now. So if you have a fever and sore throat, is it the best practice right now to act urgently and call your doctor to get tested as soon as possible?
Yeah, so that's a great question. And we've been getting this a lot. And I think one way to really think about this is what would happen if the COVID-19 virus wasn't around? What would you do if you had a low-grade temperature, a sore throat, achiness, you have a virus? Well, you take care of yourself at home. Most people do. And that's really the same thing with this one, is that you want to be able to control your symptoms at home. We talk about social distancing, but when you start having symptoms, you should really be in your house and sort of stay at home, control your symptoms sort of regularly there. Not everybody needs a test, and I think that's sort of important. Now, you saw what's happening up in New York, where they're maintaining testing mostly for hospitalized patients because they're seeing so much. It's nowhere near that level in Pennsylvania. So really the recommendation is to stay at home. If you do need to interact with a provider, this is where telehealth really comes in. At Penn State Health, On Demand, we have an application you can download and see a physician directly from your home if you have questions. We have a free coronavirus screening application as well through Penn State Health On Demand. So we're facilitating that conversation if you need, but also practicing the social distancing, and you can do it from the comfort of your own home.
And you just kind of mentioned a couple of minutes ago the symptoms of COVID-19, and they're similar to some of the symptoms of the flu. So what do you suggest people do if they're not sure if they have the flu or if they have COVID-19?
Yeah, it's really about controlling your symptoms and keeping yourself away from other people, whether you have an influenza, whether you have COVID-19 or any other viruses. The best thing to do is to stay at home. Keeping yourself isolated, allow it to run its course. Now, if it gets more symptomatic or you have concerns, that's where the telehealth piece comes in. But yes, the viruses that we're seeing around influenza and COVID have very similar symptoms.
And at this point, I know we touched on testing just a little bit, but do you think there are enough COVID-19 tests for Pennsylvanians right now? And are you worried about a backlog of testing?
Yeah, testing's got a lot of press here recently, and different areas. Who gets tests? Who doesn't get tests? Um, I think that you're going to see an increased number and availability of tests in the upcoming weeks. I know there's lots of good companies out there working on things. Our hospital, our health system, and others I know will have some things available. The testing now seems to be taking a little bit longer. It's a day's turnaround time frame. So you can start symptoms, you get a test, and you really don't know the results for 5-6 days sometimes. And guess what? That's the course of your disease. You've already sort of ran the course of the disease for most people who are going to be at home. So I think that we're going to see increasing number of tests availability, and I think we're going to see tests that are going to give us results a little bit more rapid. And I think that's going to be most important for patients with severe symptoms, hospitalized patients, and it'll help our healthcare environment to be able to make decisions quicker.
And that's what they kind of talked about, that experts expect that curve to go up because of sometimes a test can come back in 24 hours and sometimes it can take a week. So they're expecting that curve to continue to grow. When it comes to symptoms, though, if you're with anybody right now and they sneeze or cough, you're kind of getting the look like, do you have it? So how quickly can symptoms actually show up for people who have been exposed to COVID-19?
That's a great question. It's a relatively large range. We're seeing about 4 or 5 days from the time of exposure and infection till the times you would become symptomatic, and the symptoms are very wide ranging. Many people will have minimal to no symptoms, but your high risk patient populations like elderly and people who may be undergoing cancer treatments or other immunocompromised state, they're at more risk. So really, the folks who may be exposed and are starting to get symptoms, really important social distancing, but if you have symptoms, stay home.
And it seems like at this point, the virus is hitting adults and even younger adults pretty hard. No one at this point seems to be immune. So what can we tell and how can we talk about kids between the ages of babies to the age of 18, especially? What is their risk at this point?
Yeah, with schools closed, I know lots of parents are having those questions about their school-age children at home. I think you're seeing recently that many of the early infections are in the millennials area, and that's because maybe some of them did practice that social distancing a week or two ago when the warnings were out there. They're getting infected, and they may pass it on to others. Here's the good news. The good news is that it seems the more severe symptoms we're seeing is in the older and high-risk populations. While people are getting infected across most age groups, the severity of symptoms seem to be relatively low for school-age children and below.
All right, so we are getting some good news, at least from that angle. We do want to take a quick break right now. We will be right back with Krista Fletch from Penn State Health. When we come back, we will be answering more of your questions right here on Fox 43.